Sunny?
All right, so thank you for those tallies. Now, the unsettling spike in our daily COVID-19 numbers on this Thursday comes ahead of the government's planned announcement regarding the direction of our future pandemic guidelines. For more, I have Han Seong-woo here in the studio. Seong-woo, welcome back.
Happy to be here.
Right, so do you suppose today's alarming tallies, Seong-woo, will affect the details of the government's announcement tomorrow?
That's a good question, Sunny, and I think it's safe to say they will. I mean, let's think about it here. Over 1% of the entire population infected in a single day. That has to catch the attention of authorities, right? Even if they're pushing for a swift return to normal. That isn't to say, however, that the current social distancing guidelines in place won't be eased. In fact, SBS reported last night that it's already been decided behind closed doors that the cap on private gatherings will be raised from the current 6 to, starting Monday, 8 people max for 3 weeks. But whether business hours for restaurants and cafes will be extended from 11 p.m. to midnight reportedly remains to be discussed. As expected, the business community and medical community have different ideas on how to move forward, with many infectious disease experts calling for a halt to the easing of restrictions until the current Omicron peak, which has surpassed government predictions, passes sometime late next week. Some are actually accusing the government of neglecting public health in the pursuit of economic recovery. Business owners, on the other hand, are demanding, as they've been doing so for a long time now, the freedom to pursue their livelihoods without having to worry about debt piling up. It's apparent today's record-breaking surge will work in favor of the medical community. So, who knows? Despite reports being leaked on what will be announced Friday, I wouldn't rule out the possibility of the current distancing scheme being maintained for a few more weeks. What's most unlikely, however, is a complete lifting of antivirus curbs, something the public has probably been anticipating.
So, Seong-woo, as you mentioned, that this week's daily numbers appear to have surpassed the government's earlier estimates. Do elaborate on that for us.
Well, yes, Sunny. Authorities had earlier projected that the ongoing Omicron surge would hit its peak between yesterday and the 22nd of March, reaching a daily average of as high as 372,000 before beginning to decline from next Wednesday.
Assuming the peak of the surge lasts as predicted and we respond accordingly with the current system in place, we believe this wave will be the last significant threat in the nation's fight against the virus.
But we saw well over 500,000 today, so at this pace, the actual numbers won't align with the trajectory health officials have drawn out. The number of patients in severe or critical condition, currently at just under 1,106 is moving along predictions, but partially because quite a lot of them are dying. An all-time high of 429 fatalities were reported today. The number of severely ill patients under intensive care is projected to shoot up to around 2,000 by the end of this month or by early April after the Omicron surge reaches its peak this week or the next. But this, in the end, is also a prediction, so authorities may have to do some recalculating.
Now, so Korea's escalating caseloads appear to have also caught the attention of the global health body, right?
That's correct, Sunny. The World Health Organization, I'm sorry to say that over the 7-day period from March 7th to the 13th, no other country in the world logged more new infections than Korea last week at 2.1 million. That's according to the WHO, which had Vietnam and Germany trailing behind Korea at second and third, both with around 1.5 million infections each. The three were the only nations in the world to record over 1 million during the period, with the Netherlands at fourth, seeing nearly 500,000, followed by France with a little over 400,000. Let me add for reference that there was an 8% increase in the number of worldwide cases compared to the week before, but a 17% drop in the number of fatalities. At the regional level, the Western Pacific, where Korea belongs to, Europe as well as Africa saw increases in new weekly cases of 29%, 2%, and 12% each. The Eastern Mediterranean, Southeast Asia, and the Americas each saw drops of around 20%. The highest numbers of new deaths, meanwhile, came from the United States with over 9,000, followed by Russia, Brazil, Indonesia, and China, ranging from around 2,000 to 4,500 lives lost.
Right, some grim numbers right there. All right, so as always, thank you very much. I'll see you on Friday.
Of course.